Many times it's an attitude, it's a fear. We hate the fact that we hurt. We hate the fact we can't move, work, and play well. The thing that scares us the most is the unknown. And I believe the therapist's role is to be the safety net, so the patient can jump into the unknown, take that risk, because it is a risk to be able to go into the unknown. But what we've seen over the years is nobody's ever injured that way. So the therapist, the highly trained therapist, also leaps with them on the energetic level because they've been there already. Of course, there's always secondary gain. If a person has a court case coming up the next day or next week, you're struggling with them, they seem to be getting nowhere, and all of a sudden, the day after the court case, they're all better, you know. So that's a possibility too. But what I have seen, and what a lot of therapists have given up on their patients, is that they were locked in this straitjacket of fascia that they couldn't help. So I really recommend the therapists give these people another chance. If you take too much medication, it can get in the way. Sometimes, if you've had such extensive scarring, the scarring after a while histologically changes, and it's just like ligament, it can't be released. But even people with scars 20, 30 years old, you still can usually release them enough to help them significantly. It's not our role to take a patient off of medication. But the people that we do have trouble with, and most of the patients we see initially are on medication. So what we found is most people just naturally take themselves off the medication because once you start MFR, they're feeling better, they realize they don't need it, they didn't really want to take it anyway, and you know, it's blotting them out most of the time. But if we notice that we're just not getting where we think we should with the patient within a reasonable amount of time, then we'll talk to them about their medication. Again, not telling them what to do, but suggest they talk to their doctor and see if he or she would be willing to start to wean them off of it. And I always let them know that if they have a bad day, they can always go back on the medication, because sometimes medication is the only thing that helps, at least temporarily. Because you think about most of the medications, they anesthetize us. The key to healing is feeling. So if we're anesthetized to a medication, you never go to the deep levels you need to access that level of consciousness where you can heal. So unfortunately, as well-intentioned as some medication is, it completely aborts our ability to heal.